Module 3, Transplant Treatment Options. Explained briefly in the first module, you have two main options for transplant. One option is a living donor transplant, either from a family member, related, or a friend, unrelated. Living donor transplants involve the removal of a kidney from one patient, the donor, and the insertion of that kidney into the other patient, the recipient. The new kidney begins to work almost immediately after it is reinserted into a new owner. The other option for transplant is getting a kidney from a deceased donor. These kidneys come from people who have already died and have agreed to be a donor. The kidneys are preserved for transplant. If you want a deceased donor kidney, you will be put on a national waiting list, run through an organization called UNOS, United Network for Organ Sharing. This slide has a lot of information, but it explains the process that you will undergo to make sure that you get a good match for your kidney. As part of your evaluation, your blood and your donor's blood will be screened to make sure that the kidney you will be receiving is as perfect a match as possible. This is called cross-match testing, and it is done for both living and deceased donors. To help explain this process a little more clearly, here are some vocab you should become familiar with. Antigens are unique strands of DNA in your body, and antibodies are cells in your immune system that fight off unknown, foreign antigens. So, every person has certain types of antigens in his or her body. Our antibodies recognize our own antigens but fight off foreign, unknown antigens like viruses or bacteria. Siblings are the most likely to share common antigens since their DNA is the most similar. Therefore, siblings are the most likely to be a match for kidney donation when HLA testing is done. HLA testing is a fancy way of saying cross-match testing, and it stands for Human Leukocyte Antigens Testing. Basically, the test will make sure that you and your donor have similar enough DNA or antigens to be a match. If you don't have any siblings, let alone a sibling who is willing to donate, do not worry. You don't have to match antigens perfectly with your potential donor. Another part of your blood testing screens will look at your antibody levels, the amount of antibodies in your body. They must be done once every month. If your antibody levels are high, your body is more likely to fight off foreign DNA or antigens from another person, so you will need a kidney that is very closely matched to yours. Even though this may seem counterintuitive, the cross-match testing must be negative in order for you to get a transplant and to be matched with your donor. That means that there is little likelihood of rejection because your DNA is similar enough to the donor's DNA, and your antibodies won't fight off the foreign DNA. Regardless of the results from your HLA testing or your antibody screenings, you must also make sure that you have a compatible blood type with your donor. This also prevents rejection of the kidney. Look at this table to figure out which blood types are compatible with each other. If you don't know your blood type, it can easily be determined from your initial blood draws. If you are considering a deceased donor kidney, you are placed on a national waiting list until the right kidney is found for you. The amount of time it takes until you receive a kidney varies from patient to patient. A lot of it depends on your cross-match testing and the amount of time you have been on dialysis. The good news is that your wait time begins from the start of dialysis if you have been on it for a while. However, depending on your cross-match results, we cannot predict when exactly you will get a kidney. And you might simply have to wait until you find a kidney that is a good match for you. The national waiting list is managed by UNOS, the United Network for Organ Sharing. All main transplant recipients are part of Region 1, the New England Donor Bank. There are 11 total regions. Besides the cross-match testing, geography also plays a role in transplantation, as well as the organ size. Depending on where you live, it might be quicker for you to get an organ, and children often do better with child-sized organs, so they are normally first in line for other children's organs. Check out the UNOS website if you want to learn more about the waiting list. UNOS explains its computerized matching system used to make sure you get the right kidney and will help inform you of what to expect while you are waiting for a match. To present some data on the national waiting list, here you can see how many people, now about 115,000, are waiting for a kidney in America. Only 15,000 from that waiting list will receive a transplant in any given year. Here at the Maine Transplant Center, there are about 100 patients on the national waiting list. We perform about 50 transplants, but you must remember that this number includes the amount of living donor transplants. About half of our surgeries use living donor kidneys. By now, you're probably wondering how long you'll have to wait for a kidney on the deceased donor waiting list, and how long these kidneys are likely to last. The waiting time, although hard to predict, is around 2 to 6 years, even though you should expect a more realistic estimate of roughly 4 to 6 years. Deceased donor kidneys last an average of about 10 years, depending on how well you take your medications and practice self-care. Living donation involves a slightly different approach. If you know of someone, either a family member or friend, who is thinking of donating to you, they can be identified and evaluated at any time. All they have to do is call a nurse coordinator here at the Maine Transplant Center to discuss the next steps for donation. Each donor will have their own living donor team to help educate and prepare them for their part in this process. You must remember that as a recipient, their test results are confidential, meaning they cannot be shared with you. Also, their decision to donate is completely voluntary, so your donor may change his or her mind before the surgery. You must respect their decision either way. Here's some advice to help you get started looking for a living donor. If you can think of some people who may be willing to donate, don't hesitate to get started now and to tell them how to get in touch with the transplant program. Try to find someone willing to advocate for you. Talk to friends and family. Reach out to people in your community and stay optimistic. Also remember that even if someone does not have a matching blood type with you, they might still be able to donate. There are living donor kidney swap programs, which involve more than one donor and recipient. To elaborate a little further on the kidney swap programs, if the cross-match test is positive, we will look into both internal and national swap programs that will keep your options open. A few years ago, in 2014, one stranger donated a kidney, leading to a chain of other possible donations with a total of 3 donors and 3 recipients. These surgeries were all done at Maine Medical Center over the course of one very long but successful day. Don't worry too much about the details of the swap programs now, but keep in mind that they exist. Therefore, anyone who is willing to donate a kidney can help, even if they don't match with you. Once your donor is confirmed, your coordinator will discuss the swapping system more with you and your donor. Although many people choose deceased donation because living donation isn't possible, the Maine Transplant Program highly recommends living donation. The time duration from the completion of your evaluation to a living donor transplant is about 2 to 6 months, in comparison to 2 to 6 years on the deceased donor waiting list. The kidneys from living donation are usually a better genetic match, and the donated kidney usually functions right away. Also, the transplant can be planned. Recipients and donors typically have the surgery on the same day. With deceased donor transplants, you will never know your surgery date in advance. It all depends on when a spot opens up for you with a matched kidney. Finally, living donor kidneys can function 2 to 3 times longer than deceased donor kidneys. There are patients who have had their kidneys for over 20 years. For those that already have a living donor, you may provide them with the following link, part of the Maine Transplant Program's website, so they can get more information. There is an online version of a living donor handbook that can answer many frequently asked questions. Also, any person considering donation should complete the brief questionnaire, also on the website, that makes sure they are viable candidates for donation. If you have a living donor who has filled out the questionnaire and contacted the Maine Transplant Center, both of you will then complete the cross-match testing. Remember that your donor does not have to live locally. Their blood can be FedExed to the clinic for cross-match testing. Even though donors will have to travel to Maine for the surgery, they can live all the way across the country and still be able to donate. Since a donor's health is always the top priority, someone cannot donate if they are less than 18 years old, if their BMI is greater than 35, if they have high blood pressure and are on multiple medications, if they have diabetes. There will be extra testing for a donor who has a family history of diabetes. If a donor has kidney stones that are large, greater than 5 millimeters, or abnormal stone labs, or any person that has kidney stones and are less than the age of 40. If there is blood or protein present in the urine, they also cannot donate. So you're done with Module 3. Some next steps are to complete the following survey to assess your understanding. Start spreading the word about kidney donation, and don't be afraid to ask for help. You never know who might be willing to donate. Have interested and qualified living donors visit the Maine Transplant website, fill out the questionnaire, check the handbook, and contact the Maine Transplant Program. If they have any questions, the program will direct them to a coordinator to discuss the process more thoroughly. You also can proceed to Module 4, the risks and expectations with transplant.